Did you ever experience chest pain after having a big meal? Well, most of us have. Hey there viewers, welcome to another amazing video of Health Shots. Heartburn accompanied by chest pain is pretty common. However, quite possible the discomfort isn't simple heartburn. Chest pains could be a sign of impending heart attack. Signs of heartburn caused by acid reflux and heart attack often feel pretty similar. If you are experiencing chest pains, you will be taken to the ER where doctors will try to figure out if the root cause of the discomfort is a heart attack or just acid reflux induced heartburn. Wondering when it is a good time to rush to the ER? Watch this video till the end and you will know the difference between acid reflux and heart attack. Hit the subscribe button for more amazing videos like this. Now let's get straight into the video. What is heartburn? Heartburn is a widespread ailment caused by acid reflux. Acid reflux is a condition where the acids in your stomach rise high to a level that almost reaches the esophagus, causing discomfort in the patients. A strong lining protects our stomach to handle these acidic juices, but the esophagus isn't designed in the same manner. The lining of the esophagus is thinner and does not have the strength to tolerate highly acidic digestive juices. So when the acid from the stomach enters the esophagus, it causes a burning sensation extending from the abdomen to the chest. The most common symptoms of the acid reflux include burning sensation in the chest area, pain and feeling of discomfort, bitter taste in the mouth and at the back of the throat. Often the stomach content may rise back to your mouth, typically after you have changed your position to bending or lying down. These typically happen in the middle of the night if you have had a large meal shortly before bedtime. Acid reflux-induced heartburn could be relieved using simple over-the-counter medications like antacids. What is a heart attack? These days, one of the most common health concerns induced by issues such as obesity, diabetes, and hypertension is heart attack. A heart attack happens when the coronary arteries stop or limit supplying oxygenated blood to the heart. When this happens, individuals experience tightness, pressure, and constriction in the chest. The symptoms of discomfort are similar to that of heartburn. Therefore, you should be looking for additional symptoms such as pain that keeps on spreading to the jaws, arms, or neck, shortness of breath, dizziness, extreme fatigue, sweating, and overall nausea. It is important to note that during a heart attack, all of the above symptoms may or may not be present. While chest pain is a common symptom, there is a possibility of experiencing not more than 1 or 2 secondary symptoms in a heart attack. How can you tell if you are having a heart attack or it is simply heartburn? For some people, it is easy to figure out the difference between acid reflux and a heart attack. Still, since heartburn can mimic the symptoms of heart attack, many people find it difficult to differentiate between them both. Some heart attack causes are not as black and white. Even doctors cannot identify the root cause in some instances without proper diagnostic tests based on the physical symptoms. We all know that one of the most common symptoms of heart attack is chest pain, but that is not true in all cases. Atypical symptoms are prevalent in women and people with diabetes. These symptoms include jaw pain, heartburn, nausea, vomiting, fatigue, and shortness of breath. So if you are over 40 years of age with a family history of cardiac issues and are experiencing any of the above symptoms and have underlying issues like diabetes, obesity, or hypertension, it is always a better idea to visit the emergency room to get a clear insight about the root cause of the symptoms. Diagnosis and treatment of acid reflux and heart attack. Suppose a patient with chest pain and discomfort is brought to the ER to rule out the chances of a heart attack. In that case, they will be given an electrocardiogram which detects any deviation in the cardiac activity. In addition, they will be given a troponin test which measures the level of protein in the blood released during a heart attack. If the tests clear and the doctor rule out any chances of heart attack and heartburn is suspected, the patient is given a medication that coats the lining of the stomach. If the discomfort persists and there is a difficulty swallowing, the patient is further referred to a gastroenterologist for further treatment. It is often impossible to tell the cause of chest pain without proper testing. So the takeaway here is that if you are experiencing sudden and unexplained chest pain, you should get to the emergency room as soon as possible. Even if it turns out to be a heartburn, don't be embarrassed. Instead, be grateful. Now that you didn't have a heart attack, it's about time to make a few lifestyle changes like eating small meals and stopping having dinner a few hours before bedtime to having such episodes of discomfort. Have you ever experienced chest pain? Do you know someone who has? Share your thoughts in the comment section. Give this video a thumbs up and subscribe to our channel for more informative videos like this.